Good evening. You're with the Alzheimer's Society of BC for the teleworkshop, How to Speak Up About Dementia and Make Changes to the System. We're really pleased this evening to have two guest speakers from the Alzheimer's Society that will be presenting this workshop, and hopefully by the end of the evening you'll feel a whole lot more confident about ways that you can go about speaking up for yourself or speaking up for a person with dementia that is in your life. Barbara Lindsay is the Director of Advocacy and Public Policy at the Alzheimer's Society of BC, and Rebecca Morris is an Advocacy Analyst with the Society. We're going to have the workshop recorded, so if you know someone that is interested in this material and was not able to attend this evening, it will be on our website within about a week to 10 days, and they can go in there and listen to the recording on the teleworkshop section of our website. If you're listening to this workshop on the phone and you're finding that the sound is a wee bit fuzzy, a little bit quiet for your liking, you can press *4 several times, and that will help up the sound a little bit, hopefully enough so that it's clear enough for you. Otherwise, you might be listening to it on your computer, and hopefully that shouldn't be an issue in terms of volume. Your computer can control that to a fairly decent degree. We have everybody muted at this point, and once the actual presentation is complete, we'll change it so that you can unmute your own line to ask a question, and we'll also pull in a chat box. So you could either, if you're on the phone, ask the question through the phone, or you can use the chat box, and our speakers will do their absolute best to address the questions that you have. My name is Jan Robson. I'm a program coordinator at the Alzheimer's Society of BC and one of the regular teleworkshop people. And I'm really pleased that Barbara and Rebecca are here this evening and looking forward to the presentation. Over to you, Barbara.
Thanks so much, Jan. And thanks so much for all of you on the phone and on the other side of the computer. We're really excited to be able to give our very first workshop on systems advocacy. So thanks very much for joining us. So we thought we'd start today with looking at the Alzheimer's Society of BC, what we do and why we do it. And so our vision at the Alzheimer's Society is to create a world without Alzheimer's disease and other dementia. So that's a big goal and a great vision. So we've got a long ways to go still with that, and we really appreciate the support of our donors in doing that and our families who share their lives with us. The mission of the Alzheimer's Society is to alleviate the personal and social consequences of Alzheimer's disease and other dementias, and to promote public awareness and to search for the causes and the cures. And by alleviating the personal and social consequences, we mean by supporting families so that they can have the best life possible living with this disease. So the work of the Alzheimer's Society is to do 5 things. And you can see before you on the slide, if you're on the computer, that support, information, and education are the things that we do to support families and people with dementia. We do one-on-one support, we do support groups for people with dementia, and support groups for caregivers. We provide information through the website. We have many brochures and handouts that we have that are available at the resource centers. There's 19 across the province. And education, that is one of the things we're well known for, is education. We have education for people at all stages of the caring journey, and as well as there are some education programs for people with dementia and their families. We also raise money for research, but while we're waiting to find the cause and the cure, we need to help people change how they're experiencing this disease and how they're living with this disease and how the healthcare system supports them, and that's through advocacy. So the work that we do in advocacy is to help people be the best self-advocates they can when they face issues in the system, or looking at how can we change the way the whole system works to support families and to help our health authorities and governments and our municipalities really understand what they can do to support people with dementia and their families. So I'm going to turn it over to Rebecca.
Thank you, Barbara. So today we're going to be talking a little bit about what advocacy is, specifically what systems advocacy is. We're going to talk about how you can talk to others about advocacy as it pertains to dementia, and we'll talk about engaging your MLA either through writing a letter or through meeting with them face-to-face. We'll also talk a little bit about how to write a letter to your editor of your local newspaper and how to use social media to really get the word out there broadly. Okay, so I like to talk about advocacy in two ways. So there's personal advocacy, which I like to refer to as little a advocacy, and there's systemic advocacy, which I like to refer to as big A advocacy. They're both really important, and they're both things that you as an individual who's affected by this disease can take part in. Personal advocacy tends to refer to the things that a person will do to make change for either themselves or the person that they're supporting. This can include anything from securing services like home care to making sure that the care somebody's receiving in a long-term care facility is respectful, to following up about a medical issue. Many people with early-stage dementia do this on their own behalf, and many caregivers engage in this type of advocacy on a really regular basis. The other type of advocacy, the big A advocacy that I'll be talking about today, is system advocacy. These are the actions that we take on to change the system or to look for healthcare improvement. In many cases, system advocacy is fueled by our own personal experiences, but our asks tend to be more broad. We tend to be focusing on general outcomes rather than personal outcomes. They also tend to be focused on policy or policy change. This kind of advocacy approach tends to be the most effective way that we can bring about the changes to the healthcare system that we've heard from families across British Columbia that they would benefit from. When we all use our voices to repeat the same clear and consistent messages, that's where real change can happen, whether that be in the form of a political discussion or changes to how programs run and how they're affecting families on the ground, so to speak. Okay, so this is an example of individual advocacy, and I'll read the quote here for anybody who may be listening on the phone. This is from a caregiver who we worked with a while ago. It's like you have to fight for everything. You have to fight with the doctor for a diagnosis. You have to fight for the medication. You have to fight to see a specialist who can help you. Then you have to fight for help. When you need help in your home, you have to fight for that. And then you finally get them into care, and then you have to fight there. That's a really great example of personal or little a advocacy. And as I mentioned, often these experiences and these personal struggles really fuel the systemic advocacy that we try and take on. A really great example of this is Marg Kennett, who is a system advocate. Marg she was a caregiver for a number of years for her mother before her mother died. And her passion is really long-term care and specifically palliative care and improving palliative care for people with dementia in long-term care facilities. So she took her experience, which wasn't necessarily a wonderful one with her mother, and she was able to translate that into a systems ask. So Marg, up to this point, has written a letter to her MLA, she's gone for a meeting with her MLA, and she talks to many others about what she feels is needed in the healthcare system to best support families like hers. When I asked her why she is so passionate and why is she doing what she's doing as a system advocate, she said that she really wants to honor her mother's memory, and she thinks that change to the system, however small, will be a way to really honor her mother's memory.
Rebecca, I have a question for you. You mentioned a systems ask. Can you maybe explain what you meant by that term.
Sure. So I think that that'll depend on the individual. For some people, that might mean that they're writing a letter to their MLA and they're saying something like, I would really like to see a more palliative approach in long-term care facilities. That's something that would really help families like mine. So that would be something like Mark was asking for. For other people, that might sorry, talking to you, not the camera here. For other people, that systems ask might be something like, I would really like to see better training in long-term care facilities around how to care for a person with dementia. And then for more people, it might be something like, I would like to see access around earlier diagnoses, and that would have been helpful for my family. So there are really a lot of different system asks. I think there's certainly common themes that happen across people's experiences and certain barriers to appropriate care that happen across different people's experiences. But what's really important is that we're taking our individual stories and we're using those to fuel our ask, because those stories can be incredibly powerful, like we'll talk about in a little bit.
So basically the ask is what you want. This is what you would ideally want to have happen.
That's right.
Okay.
That's right. This is the thing that would help, and these are the reasons why it would help.
Okay, thanks.
And if you ever need any help kind of articulating that ask, that's what we're here to do. You don't need to do it all on your own.
So this is a quote from the McConnell Foundation, which is an Ontario-based foundation, a family foundation, and I thought it was a great one to really represent systems advocacy. It says there are no coincidences in politics. If an issue is on a platform or a policy agenda, it's because someone or a whole lot of someones have worked long and hard to put it there. And I think in the example of the Alzheimer Society of BC, one of the things that I think that really started off the whole chain of system improvement for people with dementia in BC was when our Ministry of Health chose to put dementia as a chronic disease. They recognized dementia as a chronic disease, which meant that a lot of the innovative work that was being done to improve the healthcare system that comes for chronic diseases like diabetes and kidney disease and COPD and congestive heart failure. When dementia got onto that list, it meant that the government focused on dementia and really looked at how they could help people throughout the whole course of that disease. And it really brought the spotlight of attention to dementia. So it was a big win for the Alzheimer Society when dementia was seen as a chronic disease. And I know that that there's many examples of groups and organizations who have worked really hard to have change and to see system improvement, and we really need your help. Part of what our work tonight is to ask your help to be the whole lot of someones who have worked long and hard to put it there. So we really appreciate anything that you can do to support our work and to support your lives. Thank you.
Okay. So what can the average person do to speak out about dementia? I have on the computer here, for those of you who are following along on the phone, it's a photo of somebody called Monique. Monique is a 17-year-old person who is caring for her mother who has dementia. And she came with us to speak up about dementia when we went to the legislature this spring. And here she is speaking to our CEO, Maria Howard. So Monique I find really inspiring because she's 17. I think that she's certainly an exceptional 17-year-old in many ways. But to me, she really just illustrates that any of us, you know, with a little bit of bravery, with a little bit of perseverance, we're all able to make a difference, and we're all able to raise our voice in some way.
And that the story, Rebecca, I was going to say that your story is really important, and people want to hear it. People were anxious to hear Monique and our other advocates like Jim and those advocates. Everyone is eager to hear their stories, and they can be eager to hear your story too.
That's right. So the first thing that any of us can do is just speak to other people about dementia. Tell people why dementia is something that's important to you. Tell your family members, tell your friends, tell people in your running group, people in your book club. Share your story about dementia and how it's affected your life and where you see room for healthcare improvement, how we can envision a system that's really supportive of people with dementia and of their caregivers. And it's really important to do this for a couple reasons. The first reason is this helps reduce stigma, and stigma is a huge hurdle for people affected by dementia. Just by talking about it, I think that it really moves us forward as a community by saying, you know, that this isn't something to be ashamed of. This is a horrible disease, but it's not something to be ashamed of. We're not ashamed of cancer. And then second, it helps to form a public opinion around the issue. A strong public opinion is something that gets the attention of decision makers. So forming a public opinion is really important. If you've already written a letter to your MLA or have gone to meet with your MLA, perhaps encourage other individuals who you're telling about dementia to write their own letter. Sometimes advocates who I've worked with will encourage other people to go meet with their MLA and will actually let them know that they would be willing to join them if that's something that would make the person more comfortable. Sometimes people just need that little bit of extra support. So that's the first piece that we can do. The second piece is engaging our MLA. Many people don't know who their MLA is, and that's okay. It's relatively easy to find out. I have a website listed here on the PowerPoint, but if you're listening in on the phone and you don't know who your MLA is, but you'd like to find out, you can call me. My phone number is 604-742-4939, and I'll repeat that again before I go today. Please just give me a call and I can find that out for you, find their mailing address, and make things as easy as possible. Your MLA will be kind of your key contact as an advocate. The acronym MLA stands for Member of Legislative Assembly, and this is a provincial government representative who's elected by the group of people in a particular region to represent them as constituents. More often than not, they're going to have a political affiliation. So what that means is they might be a MLA who has an NDP affiliation or a Liberal affiliation. Sometimes they're independent. So, you know, I will help you figure that all out if that's something that you need a hand with. Often people tell us that they're nervous to speak to or write to their MLA. Because for a lot of us, engaging with a decision maker is something way outside of our comfort zone. Oftentimes we think that we're not important enough, we're not well informed enough, we're not well versed in the subject matter enough, or that politicians just won't have the time to talk to us. You may be surprised to hear that MLAs often tell the society how much they value hearing from their constituents, especially about their experiences with dementia, because telling your story to them, and by doing that, it really empowers them to act on your behalf. Remember, premiers and MLAs are just people. They're elected by their constituents to represent those interests, as I mentioned. So it means that they really do rely on you to know what the people they're serving need and how, in this case, a healthcare system can help to support them. You may also want to engage with other kinds of decision makers, so for example, people at the municipal level, even people at the federal level, but your MLA for this particular advocacy issue will be your key contact. So the first thing that you can do is to write a letter to your MLA. I really suggest that you decide to write a personal letter to your MLA. When we think about presentations that any of us have seen, I think that many of us could bring to mind a time where a personal story has really resonated with us, much more than we can remember, you know, what was specifically on those slides or what that person specifically said. Personal stories really do make memories for a lot of us. So please do share your personal story. It doesn't need to be long. I really do suggest keeping it succinct. but to let them know how exactly this affects you, how it affects your family, and how it affects your community if you're just an interested community member. I suggest that you put your ask in the first paragraph. Please try and keep your letter to roughly a page, maybe a page and a half. You don't want to go too much longer than that. And be courteous. These are folks who really do try and have people's best interests in mind. Approach them like an ally, not an adversary. That really can be helpful to make sure that you're conveying the right tone. Consider asking for a meeting with your MLA to follow up about the ask that you put in your letter. And consider sending a copy to other people who could help. You might want to send a copy to the Alzheimer Society so we know what our advocates are doing out there. And you might want to consider sending a copy to your premier or other MLAs who may be close to your region.
Rebecca, you mentioned writing to your MLA as opposed to your MP, that the MLA is the best bet. Now, why would that be? Why would provincial be better than federal in this case?
Right, so for this case, a lot of the healthcare changes or healthcare improvements, how we envision our healthcare system if it were to be working perfectly, a lot of the ability to make those changes lay provincially rather than federally, so
okay.
that's really where we suggest starting.
Okay.
A few other things I want to mention. Please do remember to include your contact information. And it's important to do that not just so they can write a response, and they often will send you a response, especially if you request one, which I suggest doing. But you also want to include your contact information so that they know that you're a constituent, because those letters will hold kind of a greater priority than if you were not their constituent. So I was speaking to an MLA a couple of months ago, and I said, you know, I know somebody who lives close by you who would really love to come and talk to you about their experience with dementia. Her first question was, are they a constituent? So that's a really key piece. So do you live in the area which they've been elected to serve? Follow up on your letter. If you don't receive a response, do consider following up. And please remember, you know, your MLA's job is to listen to their constituents, and you have a lot of expertise that you can bring forth to them. Okay, so I'm going to read a couple of letters here. So they're made up. They're nobody's real letters. One is an example of a letter which could be improved, and another one is a letter that's probably an okay letter to send on. So I'm going to read this first one aloud, the one that could be improved. Hi, Mr. Partridge, which isn't a real MLA, by the way. Why can't you people get the healthcare system right? I was in emergency with my husband for 5 hours last week, and some stupid nurse didn't understand anything about dementia. And then she said, and so it'd be a big rambling piece, and my husband was confused. We need a change, and we need it soon. I would like to hear from you about what changes the government is going to make to fix these problems. Thanks, THX. So there are a couple challenges with this letter, or as far as I see it. The first big thing is that it's not written in a very collaborative, respectful, courteous tone. Sometimes we really are angry when we're looking to make changes in the system, especially because a lot of times our system advocacy work is really influenced by our personal experiences. But we want to try and make sure that we're being constructive and open when we're approaching these discussions, even if we are feeling personally quite angry about things. The second is, you know, if this person was to kind of continue where I have the ... dots in there about what exactly happened in the emergency room, that might be, it might go on for a little too long. We want to make sure that we're keeping things quite short and quite to the point. And then the other thing that I would note is that the ask is down below rather than right up front, which can be a little bit less effective.
That would probably be a good letter to write
the night that it happened and then rip it up the next day and write the real letter.
Exactly. That's a really good point. Sometimes when we're feeling angry, it can be helpful to get those words out and to have a little bit of a rant. But when we're doing our systems advocacy or even our personal advocacy, we always want to try and approach things in that respectful tone. Okay, so here's an example of a letter that's a little bit better. Dear Minister Sawatsky, again, not a real minister, I'm writing to ask you to support the expansion of the First Link program across British Columbia. My husband received a crushing diagnosis of vascular dementia in 2009, and since then the program has been a huge help to me and my family. Without First Link and the support and education which it's connected me to, I don't think I would have been able to care for my husband at home as long as I have. I'm passionate about this issue because I know that this journey would be much more challenging for those who live in a community without First Link. I hope to see the program expanded as a way to support caregivers for people with dementia across BC. Do you support the expansion of First Link as a way to support caregivers and further the Dementia Action Plan? Yours truly. So you can see it's written in a much more respectful tone. You can see that it's personal, but it's also to the point and has a really clear ask. And it's requesting a response. So that would probably be an example of a letter that's more effective. And it's probably going to land on the ears of decision makers a little bit better. But it really does still give you an idea of how dementia is affecting that particular family and why the ask is important to them.
And Rebecca, can I just add that we can even probably make it stronger, the letter, if we actually specifically how the MLA, how you would like to see the MLA actually do that, maybe by speaking to the Minister of Health to say, to please let the Minister of Health know that I really support First Link and think it's a great idea. And that might be something that the MLA would have a clear idea of what you want them to do, because when they read the letter, they might go, oh, sure, I would support that, but there's no action really required beyond that. So that would make this letter even stronger if we actually made it clear to the MLA what they could do.
That's right. Good point, Barbara. And sometimes coming up with these asks can be challenging, so that's something that we can help you with, constructing an ask that's appropriate. Okay, so today I'm suggesting that we take an advocacy action together as a really good place to start. I'm suggesting that we write to the Premier, and I'll give you a little bit of background on this. So in August, Premier Clark will meet at the Council of the Federation with other premiers to discuss dementia. It's the first time that this topic has been on the table in a national capacity, which is really, really exciting. And we're hoping some good things come out of this meeting. So we want to let her know that this is important to BC families and that BC families are behind her as she's preparing to attend these meetings, and that we're really encouraging her to support a government focus on dementia as a healthcare priority and as a way to keep dementia at the political forefront. So this letter will be available as a handout after this presentation, or if you contact me, once again, my phone number is 604-742-4929. I also encourage you to send a copy of this letter to your MLA to keep them in the loop and to let them know as well that this is something that's important. Anything to add to that, Barbara?
Well, you know what, I was just thinking, nothing specific about the letter because I think it's great, but I was thinking that that one of the things is that we often hear is that MLAs don't really get thanked very often, right? So that they don't always hear that something that they've actually done or that their government has done has moved and brought about the change that you're requesting, so that we do know, for example, that First Link is being funded by the Ministry of Health to the extent that it is already, and maybe adding that it would be great, it might be great to add that thank you so much for for the advantage that I'm receiving from First Link. And then from your letter to the Premier, it would be great to keep in touch with us and maybe find out how the Council of the Federation meeting went, and then we could send a letter to the Premier to say we're really thankful for the direction that the meeting took with respect to dementia. So staying connected to the society and pay attention to the news as well. When it was announced that this was going to be on the agenda for the Council of the Federation, that dementia was going to be on the agenda, there was quite a bit of news coverage of it. And so hopefully there will be again this summer when we hear how it went. But letting the Premier know of how much we were appreciating it would be, I think, another way to cement that relationship with her, and the fact that putting dementia in her, let her know that dementia is important to so many of the people who are constituents.
Absolutely, absolutely. So the next thing that I'd like to talk a little bit about is meeting with your MLA. And for a lot of people, this can feel really intimidating. Many of us feel that our concerns are only really legitimate if we are an expert. And I'm here to tell you that if you're affected by dementia as a person who's living with the disease, as a caregiver, or as a community member who feels that this affects your community, you are an expert. And where your expertise lies is in your experience. So please do feel like you have an expertise as you're going into this meeting, and that you have a story to share that can be really helpful, because you do have a story to share that can be really helpful. I want to share a few tips for meeting with your MLA. The first is consider going with a group. And when I say group, you probably don't want to go with a really large group. You probably want to go with one or two other people who can help support you, but a small enough group that you can kind of keep things on topic. Come prepared, so decide who's going to say what and who's going to say what when. Don't expect to need to be an expert in the sense that you're a society representative or have the expertise of a physician or anything like that. You know, it's okay to say so. It's okay to say when you don't have the answer, or even better yet, I don't know, but I can talk to somebody who may and get back to you. Be on time. The MLAs that you'll be speaking to are generally really busy. Meeting with them, meeting with you is a priority, but you do want to be respectful of their time, and that includes keeping to the time limit that you've set. So you don't want to turn a half an hour meeting slot into 2 hours, because that's not respectful of their time. If there are follow-up items at the end of the meeting, summarize them at the end of the meeting. It can be really helpful to make sure that everybody's on the same page. And then there's a couple things that you want to do after your meeting. So after your meeting, you want to follow through with any action items that you've discussed, and to do that promptly while it's still top of mind for the person you've met with. Consider sharing this on social media. As Barbara said, politicians really do like to be thanked. So if we're able to thank them on social media, if that's something that you're comfortable with using, it can be really great to just tweet a quick thanks, or share something on their Facebook wall saying, thanks so much for taking the time to hear my story. I appreciate it. I look forward to working with you in the future. If you're not comfortable with social media, it's really great to send a thank you note, whether that be by email or through paper. And then follow up. It's important to follow up kind of in a timely way, so perhaps 6 months, perhaps a little bit longer than that, whatever you kind of feel is appropriate, just to say, again, it was really nice to meet with you, wondering how things are going, wondering if there's been any progress on the things that we talked about. And as I've already mentioned here today a couple times, remember, your experience does make you an expert. You have a lot to share as a person living with this disease or as a caregiver. And if we're not raising our voices about those kind of day-to-day experiences, people just aren't going to know. So we are able to create a smoother journey, but it's going to take all of us to raise our voices, and it's going to take all of us to speak clearly and consistently about the challenges that this disease brings, especially as it pertains to health care, but also as it pertains to things like transportation. And if we're talking on a municipal level, things like accessing the library, that can be challenging when we have a diagnosis of dementia. So breaking down those barriers.
And Rebecca, I just wanted to tell you, I really liked your point about consider going as a group. Last year we were working with two caregivers from a small community, and they were both so nervous about the idea of going to their MLA, but very interested in it. And they decided to go together, and they had a really wonderful meeting. They found that going with another person, they were able to remember things that they might have not have remembered. You get so nervous sometimes you don't always remember what you said or what was said to you, and one could write notes while the other was speaking, and they found it made a huge difference. And their MLA did remember them, seeing them in the community later, said, "Oh, hi, Dorothy, hi, Doreen," and that really meant a lot to them that he actually had, it was a sign that the meeting was meaningful. So I like your advice there, Rebecca.
Absolutely, and that just brings something else to mind for me. If you are meeting with somebody else, if you are going with either a family member or a friend or somebody else to this meeting, it can be really helpful to debrief after. So what went well, what didn't go well, where there's room for improvement, what kinds of things should we follow up on. Even if you aren't meeting with somebody, it can be helpful to debrief with somebody you trust. So whether that be a family member, a friend, you can call me and talk about your meeting if you like. You can call me to prepare for your meeting. So just another reminder that I really am here as a resource for you folks when you're engaging in this kind of advocacy. Okay. So, sorry, go ahead.
I wanted to add, I think it's so important to have those personal stories because the MLAs, I'm sure, are getting studies and briefings and discussion papers and things like that are important and that have important information in them. But your personal story has emotion in it. And I think all of us, most of us at least, tend to remember things that have emotion attached to it. Those kinds of things are going to resonate with the MLA long after the briefing and the research paper has been forgotten.
Yeah.
Really, that personal story brings that issue into reality.
Brings it to life.
Yeah, exactly.
Sure.
Thanks, Jan. That's good.
Absolutely. So another way that we're able to get attention to the advocacy issues that we care about is writing a letter to the editor. When do we do this? Well, whenever dementia is in the headline. So we're able to take, stories that hit either your local newspaper or perhaps even the province or the Sun, and take those stories and bridge that story to your experience as well as the need to keep dementia on the political forefront. So this can look differently depending on what your particular passions are, but whenever that headline is coming up, it can be a really good experience to move forward on writing a letter to the editor. You can send those letters either through the mail or directly through the newspaper's website. Now, a lot of times you can submit your letter to the editor, right online, and that can make things easy as well, and it can make it easy to respond in a really timely way. Plus, postage is going up, so there you go. So again, something I can give you a hand with if you've got an idea, you've seen an article that for whatever reason really resonated with you and you'd like to make a comment, I can help you work through that. Okay, so on the screen here, I'm just showing an example of a letter to the editor authored by Jim Min that was published in the province not so long ago. So I won't read this one out loud, but it's an example of how you can leverage an article and bridge to make your case for an advocacy ask.
And just on that point, this whole idea is really one that we've got from Jim Mann, who I mentioned earlier is one of our key advocates. He brings so much experience and passion to advocacy that Rebecca and I have learned so much from him. And I think it's a great idea. So just recently there was something else in the news about about the death certificates and how they don't really often enough really identify dementia as the cause of death. And we've had so many families write to us and ask, now, does that mean that that the attention isn't going to be given enough to dementia within the Ministry of Health if they don't realize how many people really are affected by this disease? And it's the perfect idea to have written to the newspaper to say that very same question, and that would have enhanced and made that story stay in the news for a longer time. So it's a great idea from Jim on that one.
That's right. Absolutely. I've got lots of ideas. Lots of ideas from Jim. Okay, so social media, we can use social media as a tool in a lot of the same ways that we can use a letter to the editor. It's just a little bit different. So there's a couple ways that you may want to use social media if you're somebody who is social media savvy. You may want to use social media to thank a politician once you've had a meeting with them, or perhaps if they've gone public and they've said something that you consider to be positive. You may want to retweet that and thank them for that and just really reinforce that, yes, this is something that BC families are looking for. You may want to share a photo of the two of you at a meeting. They can really like that sometimes. Of course, do this with permission, so ask them if it's okay first. Oftentimes they like to retweet it themselves. And then the final thing is, really share, tweet, or like, or repost society messaging. So at the Alzheimer Society of BC here, we do have both Twitter and Facebook. So if you see messaging that you like, please do share it. And there's a couple reasons for that. The main one being that it's really a great way to get the word out there to a broader audience. There's probably people in your network who really do care about dementia like you do, but they may not know where to start or how to do that. So it's another way that we can spread that message, break down stigma, and promote a public opinion on a subject. Please remember that it's always important to be courteous when we're using social media. So whether we are interacting with a decision maker or whether we are making comments, good kind of golden rule is never say anything on social media that you wouldn't say to somebody's face. So please do remember to be respectful and courteous, even when we are, again, feeling angry about certain things.
Andy, you've got your hand raised. We will open it to questions in just a few minutes. So sorry we can't address it right away, but we'll put the chat box and we'll open up the phone lines in just a couple of minutes.
Okay. Please remember that it is also okay to ask. MLAs like to use social media to show their support. So whether we're asking decision makers to show their support on social media or whether we're asking them to ask a question in question period at the legislature, it's okay to ask. And this I'm showing on the screen right now is a screenshot of the Society's MLA remessaging something that he had met with an advocate in our area about. Okay. So Barbara's going to tell you a little bit about our advocacy workshop.
So we'd really like to get to meet you. And we've been traveling around the province last year and beginning again this year to meet you where you live. And in the picture that Rebecca has put in front of you is Jim Mann, who we've already identified as is one of our key advocacy volunteers, and he really is a magnet for other people to learn from and to be inspired by. And so this is a photo of him at one of our advocacy workshops. And people are really riveted to hearing about how is a person with this disease, living with this disease and leading change, and putting himself out there to say that this is my vision of change, and I'm inviting you to participate and support at the advocacy work. And it's really inspiring to hear Jim. And so Rebecca and I and Jim are going to be going to a number of communities this summer and in the fall, and we're hoping that to invite that you will come out to our workshops. And if you keep in touch with us, you will find out where we are coming. And our website also will have details about those workshops. And what we do at the workshop is also to spend some time looking at how to do a letter to support the advocacy ask that we're working on. And as Rebecca mentioned, currently we're looking at letting the Premier know how important it is for us to see that she's supporting dementia on the national scene at the Council of the Federation meeting with her colleagues, Premier, and the premiers from the other provinces. So the workshops are a great way to meet other people who are interested in advocacy and to learn and be inspired by Jim and his stories, and to find out how we can all work together to bring about that change that we've talked about all evening.
That's right. And if you, just on the note of keeping in touch, if you would like to find out more about what we're doing, please do consider joining our advocacy mailing list. And if you send me an email, I can make sure that you get those updates. My email is rmorris, so that's RMORRIS at alzheimerbc.org. So that's Alzheimer without the S, bc.org. Okay, and it's up there on the slide as well for those of you on the computer.